And as the virus continues to spread worldwide, there's a whole lot of misinformation out there surrounding the epidemic.
So how do you prevent it? How do you even treat it? And what about a vaccine? CBS 2's Dr. Max Gomez here now with some answers for us.
You know, first of all, coronaviruses are extremely common. They can cause a wide variety of respiratory illnesses, ranging from the pretty harmless common cold to the highly dangerous Middle Eastern respiratory syndrome, better known as MERS. This new strain of coronavirus falls somewhere in between. The coronavirus is called that because of the many crown-like protrusions on its surface. And like other coronaviruses, this is a respiratory virus that causes pneumonia, the main way that it kills. It is contagious by breathing in infected droplets from coughs or sneezes, although hand-to-hand transmission is probably more significant. It's also a fairly hardy virus. A German report says it can survive on surfaces for as long as 9 days, which partly explains why it seems to be spreading so rapidly.
We have countries that are starting to have community spread, which is essentially getting us closer and closer to what you would consider the definition of a pandemic.
Those numbers are becoming concerning. Although in the U.S. there have only been 58 reported cases, globally there have been more than 81,000 cases and climbing, with at least 2,700 deaths, the vast majority in China. But today at the World Health Organization, the director said there is a glimmer of good news.
For the last 2 days, there have been fewer reported new infections in China, but the numbers could go up again.
Another glimmer of hope came from Gilead Pharmaceuticals, saying that the University of Nebraska has begun testing its antiviral drug remdesivir against the coronavirus. And Boston biotech company Moderna reported that it has shipped vials of a potential corona vaccine to the NIH to begin phase 1 human testing, although experts there say it could be a year or more before a vaccine is ready for use. And as with all respiratory viruses, including the flu virus, the best way to prevent getting infected is hand washing early and often with soap and water for at least 20 seconds. No soap and water, an alcohol-based hand sanitizer also does the trick, but you got to do it all the time.
Yeah, a year or more for the vaccine to be ready to go. Why? That feels like forever.
It does, but you know what happens is you make a vaccine and then you have to test it to make sure, number one, that it's safe, number two, that it's effective. I can't give you the vaccine and then try to give you the virus, try to give you coronavirus, right, to see whether it worked or not. That's not ethical. So what you have to do is you have to give it to a lot of people and then see if that number is fewer than the people who would have gotten that disease without being vaccinated.
So while we wait for this vaccine, what about prevention? And a lot of these videos that we've been seeing people with those masks, surgical masks on. Are those effective?
No.
No.
It will keep you
from getting money.
It'll keep you from getting me sick. Okay. So that if you cough or you sneeze, it's all trapped in here. But if I'm wearing it, basically I've still got to breathe in some air somewhere, and that's still going to get, and besides, hand-to-hand contact is really primarily how it's going to be transmitted. If you get an R95, you know, gas mask with the canisters, that'll do the trick.
Getting a little carried away.
But the little paper masks, I'm afraid it's not going to do all that much for you.
So maybe we even forego the fist bump now, huh? Just do a little elbow or something.
Just kind of go. Nice to see you.
Okay.
Thank you, Doctor.
Thank you, Dr. Max.
Good information.